Hello, everyone, and welcome to another episode of Teeth Matter. I'm your host, Ellie Halabian, DDS, and in this week's episode, we're chatting with my very special friend, Dr. Jamie Ko. Dr. Jamie is a general dentist out in Calgary, Alberta. She is, well, for some of you who don't know, that's in Canada, and she is a beautiful, beautiful person who shares her journey about life, relationships, growth, and dentistry on social media. And it's my great honor to share this conversation with you about personal development, career development, and the synergy between the two. So let's dive in. Perform better at work, be healthier physically and mentally, so that you can have a productive career as a dentist. Let's dive in. Dr. Natasha Sarwar. Hi, thank you so much for being here on Teeth Matter.
Absolutely. Thank you so much for having me. I'm excited for today.
I'm very excited for today because you are the expert when it comes to ergonomics, pain-free dentistry. And if you follow your page, you have like so many good tips out there. And I've come to like realize a lot of things that I didn't know before when it comes to my day-to-day practice just off of your Instagram. So we're going to get into all those details, but tell me, why is ergonomics so important?
To me, it's vital, and why I've been focusing on it more and more lately is because dentistry is so tough on our bodies. Dentistry has a component that a lot of other non-healthcare, professionals who may have desk jobs, they have similar ergonomic problems, like sitting at a desk all day and typing, but we have that component plus working with patients. And it's so burdensome on the body because you're looking at a small scope, something so tiny, and you have these magnifying loops that help us, but it doesn't always allow us to stay up and right. So the injuries that I've seen and the pain, the debilitating pain that doesn't just stay when you're at work. It follows you at home. It follows you on vacation. It follows you when you try to play with your kids. That's kind of where I've seen a lot of these injuries take people, and it just ruins their lives. Makes it a lot harder for them to be happy, live and enjoy, hike, bike, play with their kids. So that's why I think ergonomics is so important, because dentistry is a tough field and it just follows you everywhere, the pain.
Absolutely. I remember when I first started off in dental school, I was doing a lot of this when I was at the type of time. And obviously you get better with that as you practice, but still we have once we develop a habit, we're kind of stuck in that habit and it's hard to kind of change. When did you notice that you were developing these bad habits and it was time to change your ways?
Sure. I definitely did the same thing you did in dental school, looking over this way. And even as I was, typodonts were there, but even as I was treating patients, I was always one of those dentists or dental students who forgot everything at the supply counter. So I'd be running back and forth. My time would be eaten up. So, you're trying to do whatever you can as fast as you can. And that means ignoring indirect vision. That means leaning over and doing what you can. So my bad habits started from there, and they just followed me through all my associateships. And I practiced for 10 years before I transitioned out. But I would say year 5, I started noticing that I was aching. I was aching really bad. Not only my neck and back, my wrist was starting to hurt me. I started to get hip pain. So I started to try to make changes at that point. But I'll be honest, it's difficult. Once you become, you get into that habit, it's so hard to make a change. So I would be good for 2 or 3 weeks and then back to what I was doing before, especially when I would be, doing an extraction or seeing kiddos. Very difficult for me, or a number, 15 crown. You do what you need to do to get the procedure done. And it's so common just to think like that. I have 4 hygienes waiting, I have, an endo in the next room I need to get to. So we do what we need to do to get the procedure done. And I would say it wasn't until I really suffered a debilitating injury that I tried to really change my ways. And that was last year. So almost 10 years of practicing before I really realized that, hey, this is something we really need to work on.
So, when was the first time that you realized that you are in pain and you need to change your ways?
So it started around year 5 when I started to feel more and more pain, not just in my neck and back, but it started to feel it more in my wrists and my hands as well. I would be doing extractions or holding the handpiece, and I would notice my grip was not as strong, or I would start to feel very fatigued quickly. And then, I would try to change my ways for about 2 to 3 weeks. I'd be great, and then it would start to go sideways, especially if I was treating kiddos or had extractions, or a crown on number 15 that required us to get in there and work as fast as we can because we have 4 hygienes waiting or an endo in the adjacent room. But it wasn't until I really started to feel the excruciating neck pain really is where it started. And that was last year, pretty much a year ago, is where I said things have got to change. And I started to dive deeper in how an ergonomic setup would look like in an operatory, how I could position myself in a better way to treat patients so that I would minimize my pain, my tenderness, but even speed up or make the operatory more efficient or make the procedure more efficient. I was an associate, so I didn't have as much capability as I would have liked to change things out, but I did the best that I could. And I think it did make a difference, but I'll be honest, in my case, I think I was too far injured for it to make a drastic difference in where I was. So that's kind of where I am today, is trying to get the message out about ergonomics and really hoping that younger dentists incorporate it now more, because after you do get to a certain point, it becomes a lot more difficult for your body to create habits and adjust to those new habits. And the tenderness and the pain that you have becomes a lot harder to manage.
You touched on a lot of good points that I want to delve into, and I feel like if we go into each one, we're going to go on a different tangent. But one part was that you mentioned that you have this patient, you're doing the 15 crown prep, you have like a root canal in another chair, another like recall in another chair. Do you think that the emotional stress exacerbates the physical pain?
Absolutely. Ergonomics has a component of psychological stressors that impact the body. We call it like behavior ergonomics, and stress and pain are linked. The more you have, the more stress you're under, the tenser your muscles become. And if you're working with tensed muscles, there's a large chance you're going to have aching, spasms, strains, just because of the way the muscle groups are when you're working. So it's highly correlated, 100%. I've even commented in the past on like, forget, the stress that comes with dentistry itself, but even like workplace stress, coworkers, bosses, whatever the case may be, that stress alone can also create more tension in the body and lead to more ergonomic strain and injuries.
Interesting. And you also, I mean, for someone who has all of this pressure, physical pressure, emotional pressure, we do deal with this on a daily basis. What what are the most common areas of pain that dentists experience because of this sum of stress?
Yeah, absolutely. The neck, the back, and the wrist, I would say, are the three top. Shoulders come into play, but it's kind of more connected with the neck and the back. But the neck, the back, and the wrists are three of the top areas that dentists start to feel a lot of tenderness, and then it leads to things like carpal tunnel syndrome. You can get, degeneration in the neck and in the back, pinched nerves, bulging discs, things like that. And these these areas of concern are because of repetitive motions that we go through as dentists, or what we call awkward positions. So like when we're going and doing a filling, you have a handpiece in your hand. Not only is it, a lot of handpieces are thin, And what it does is when you go to hold a handpiece, you're using a lot more what we call pinch force. So you're holding it really tight. It's not only vibrating, so and it's thin. So that vibration you have to control as well. With the hand, the burr speed, is going at a bazillion miles per hour over there, and so you're trying to hold it as tight as you can with precision. So you're holding it in that position, and a lot of dentists are not keeping their arms parallel to the ground. They're not keeping their elbows close to their sides. We're up and we're going at it in any way we can. So that right there, you're holding it. If you're doing a filling, you're holding it for a couple of minutes at a time. And then you're reaching for another, etch or bond or whatever the case may be. But then you're going right back to it. So that repetitive motion and the awkward position that you're in and you're keeping it there is putting so much pressure on your muscles that you don't even realize it initially. You don't feel the pain of it. You don't feel the tenderness of it. Not until over time we start, our muscles start to get more and more fatigued, more and more stress, and the tension that builds up in there will lead to a spasm or an injury. So these are the things that we need to take into consideration when we're doing a procedure. The best way possible to sit, our posture, our instruments. It's not something that comes naturally to dentists, I don't think, because we've always been in the arena of do your work, move to the next patient, get the job done, treat the patient with the utmost respect, but we tend to forget how we should be treating ourselves and our bodies. So that's where we see a lot of pain and tenderness come from, or static positions and pinch force. And when we're doing an extraction, we're holding the forceps tight. We're in awkward positions, we're hunched over, crazy positions that we're in, and we're doing it multiple times. So you're in there. If you have a long extraction, it can take 20 to 30 minutes for a tooth that's broken, so that over time adds up, and your muscles do get fatigued, and fatigued muscles get injured.
It was really interesting. I saw on your page that you posted something as small as a dull burr can cause you pain. And I never even thought about that before.
Mm-hmm.
Yeah, please tell me.
Yeah. So a dull burr means a burr that no longer has a sharp edge to it. So when you're going in and cutting a tooth, say for a crown prep, and you're going in even with a diamond burr, you're having to put, with a fresh new burr, you're not having to put much pressure at all, much force. The minute that burr starts to get dull, you're adding extra pressure and extra force from your hand. That force has to come from somewhere. That you're putting more pressure on your shoulder muscles, your arm muscles, your wrist, your hand, and over time that gets fatigued. The whole system goes up back to your neck. Like I said, the more pressure we're putting on our body, the more likely we'll sustain an injury in the future. It's a cumulative effect that adds up over time.
Right. And so what is the ideal positioning for a dentist when you're doing it, let's say, a filling or restorative procedure?
Sure. So I'll start off with the posture of, head and neck. You want to try to keep your your chin retracted so that your ears are over your shoulders, which are over your hips. So shoulders back. And, nowadays we have ergo loops, which are amazing in doing that. A lot of dentists I've spoken to who've had back pain before now are feeling a lot better with those ergo loops because they allow you to stay more upright. So definitely recommend those. And then the other thing that we want to think about is our arms. We want to keep our elbows tucked as close as we can to our sides. Now, I know it's impossible, but the better we can do it, the less tension we're going to have in our body. So you don't have to be perfect, but the more you improve, the better it'll be, right? And then you want to try to keep your forearms at a parallel position to the ground. So more at like a 90-degree angle. And that means patient positioning. When you position your patient, you want to do it so that it's comfortable for you. And I know that a lot of patients give us trouble on, oh, I don't want to lay back, or that's too far down, or there are ways to mitigate that. Using a neck pillow, giving them breaks in between, procedures. If you're doing a filling and a crown on the same day, there are ways to help alleviate that stress for them, but also give you a better positioning so that you're not putting your body in extra stress. And then the other thing is a lot of dental offices have um, stools or chairs that have flat seats on them for dentists. Um, I recommend that you try to sit with. It doesn't have to. I mean, a lot of people like saddle stools. It doesn't have to be. It can be a stool that has a seat pan that can move. Um, so you want to try to keep your hips above your knees, and that's going to help as well when a patient is lying down for you to be able to slide underneath them in a better way.
Interesting. Yeah, people have recently started asking me about preference in saddle, not saddle, and it's something I never really took into consideration until recently when I've been seeing all the content you're putting out there, and also realizing like I have to take into consideration my comfort. I don't
Yeah,
do that when I'm at work, and we mentioned like being an associate, and you don't have the power in that office to kind of um, mitigate the schedule. So for someone who is an associate and you're running between rooms, are there any recommendations that you have in order to like optimize your day and also optimize your comfort?
sure. So one thing I like to do is keep everything ready. So in the morning, if you're there in the morning and there's like time before the day starts or the night before, you want to look at your schedule and say, I have X amount of restorative procedures, I have X amount of extractions or root canals or whatever the case may be, and have the trays ready. Have everything ready for you, set up and stored. The other thing is in the room, you want to make sure that everything is at an arm's length away. So you don't want to have to reach for things or get up and really move more than you have to. Of course, there's always occasions where you have to. Um, the more you reach and twist, the harder one, it's going to take more time to do the procedure, and then two, the more difficult it is on the body. You're anytime we're twisting, you're creating tension and torque in the body, the lower back especially, where we tend to have a lot more pain. So if your assistant is working with you, the most efficient way to have everything set up is in one arm's length of them and one arm's length of you. So depending on how the room is set up, you want to be able to grab your handpiece without having to lean or pull anything close to you. You want them to be able to hand you instruments that are within arm's length of them as well. That's going to be the most efficient and create a better system, a more productive system. The more you have to look for instruments, the more you have to get up and do things, you're going to create a time crunch, right? So you're not going to have any time between patients, or you're going to run late. And that's when we start to do, the twisting and turning. We start to use more direct vision, and it eats up our time to maybe do a micro break, a stretch in between patients, or have a drink of water. So just being more in tune with what you have going on in your operatory and keeping things systemized, you're going to have a lot, it's just going to be faster for you.
Right.
And then the other thing you want to do is definitely hydrate throughout the day. I think we always forget about that. It's really easy. I mean, I've had associate shifts where I think I only drink water in my 15-minute lunch break. So definitely it's hard, but if you can keep, a water bottle somewhere nearby where in between patients you take a sip, and definitely prioritize that. Take a sip, stretch, doing some hand stretches, going like this in between patients, you're gonna see the difference. It seems minor, but even if you're running, one op to the next, before you get into that op, use the door frame to stretch a little bit. The other thing is if you're, if you're in a procedure, for example, like a crown or a filling where you have a few minutes between, the the curing of the bonding, or washing of the etching, or making a temp, use that time to do some stretches. There's easy stretches where you can just do it sitting in the chair. You can utilize that time to create better habits.
Right. I think that's a great point, especially when it comes to drinking water. I feel like I myself don't hydrate enough, and it affects my mood during
Yeah.
the day. And then I also realized that I'm not even eating breakfast before I go to work. How important is it to fuel up before work, and how does that affect your attitude? Because I think I've
Oh,
personally, like from my own experience, I feel like it's been a big game changer.
yeah, 100%. I agree. our body needs that fuel because we don't, I feel like in most of the offices I worked in, we're never guaranteed a lunch, right?
Mm-hmm.
So either you have some snacks in your bag that you can quickly eat, but having a nice protein filled breakfast is going to sustain you a lot longer. And then I don't know a lot of people that don't get hungry during the day, but most of the people I do know, we're hungry, we're starving by some point.
Right.
And I think it definitely affects your speed. If you're tired, you're going to become more sluggish. You're likely to make mistakes, and your posture just is not there. You're not going to have the energy to be like, let me sit up straight. You're tired. You're hungry. You're not focused, and it definitely affects your mood because I don't know about you, but I definitely get hangry. Not the happiest person when I'm starving. And it definitely can affect your relationship with patients. And if you're not in your best self and you're interacting with a patient, there can start to be some tension between you and the patient, which leads to more tension in the body. And we don't want to carry that tension because that psychological tension and stress on top of physical stress is a bad combination.
I mean, I noticed personally, like if I wasn't eating, I was more irritable. And then in terms of the work, I was just unhappy with the quality of work that I was doing. I felt like I was making, like you said, more mistakes or um, not that I wasn't trying to do right by the patient. I was, but for some reason, the outcome wasn't as great as I wanted it to be. And then when I did feed myself and fuel myself and go into work energized, I was stronger, I was happier, I was more patient, and then I was more satisfied with the work that I was doing. And this is like a new change that I've made because I live in New York and we just run on coffee in the morning. But
Yeah.
this is a new change that I made, and I see the benefits of it. And so now I'm trying to adopt this and make it more of um, a regular thing, a regular routine. Uh, the interesting thing is, a lot of people who know they're in pain, like they feel the pain, they know they have back pain, they have shoulder pain, but they don't make the effort to take care of themselves, right? Or they say that they don't have the time, they're too busy, they're like, they have to rush to work and then they get home and then there's laundry and dinner and this and that, sometimes family. What do you tell those people? How do you make time for yourself?
It's absolutely hard. I was in that boat for a really long time. Growing up, I was an athlete my whole life. In college, I worked out every single day religiously. Then dental school, I started to, be busy and I couldn't do it. Um, and I think in the last 10 years, I probably went to the gym maybe 30 times, if that. So I was one of those people. Every day I was like, I don't have time for this. I don't have time to stretch. I don't like yoga. I don't like this, or I'm not doing that. Or if I can't go to the gym for 1 hour, I'm not going at all. Every excuse under the sun. And that only leads to your potential injury. You know, um, there's there's excuses like we have kids. So what I started to do is whenever my kiddos were playing outside, I would run with them. I'd be like, oh, let's play tag. Or while they're, going down the slide, I'm doing some stretches or jumping jacks or something to get my, cardio going, to get some exercise in. When they're eating dinner and if I finished a little bit earlier, I would take that time to just stand there and do some yoga poses. They would literally look at me and be like, what are you doing, mommy? But to me, I'm incorporating it in whatever time I had. There are days where I literally couldn't make it to the gym, and that's fine. There's times you can figure out to do it, when you have a few minutes throughout the day. And they always say that your children seeing you exercise is good for them because they understand the importance of it. So I wouldn't be deterred from that. If you don't have a family and you have a really long demanding job. I know people who are working from like 7 a.m. to 6 p.m. at night. You're exhausted by the time you come home. What I always recommend is, you don't have to go to the gym. You can do some stretches at home. Yoga is phenomenal. And it's not that you don't need to be super energized to do yoga. There's so many different types of yoga that you can do, but it's so impactful for your body because it helps strengthen and make you more flexible. And that's key in dentistry. Meditation is actually quite restorative as well. So even meditating for those days that you just can't make it to the gym, journaling, because all these things help with not only physical fitness, but psychological fitness, right? So we want to be able to de-stress physically and mentally. So really incorporating some of these things in the days that you feel like you can't go for a run or you can't strength train. There's other ways that you can make yourself fit, whether it's mentally or physically. And I think that's important to really try to fit it in. And if that means 30 minutes less of Netflix or scrolling on your phone, we need to do it because it's so important and so vital. You know, we tell our patients, oh, you have time to floss, but we don't have time to go for a walk or, you know, to do some exercise. It's definitely impactful to us.
Yeah, no, I completely agree with you. And the interesting thing is we've just talked a lot about movement and to help de-stress and declutter and gain more strength. But what about something restorative like sleep? How important is good sleep?
Oh, sleep is the most important thing. Um, I'll be honest, you know, getting into bed at the same time every night is hard, is really,
Mm.
really hard. Most people can't do it, and that's absolutely okay. And, you know, I know that there are a lot of sleep docs or sleep coaches out there that'll say you have to get into bed exactly at the same time. To me, that causes extra pressure on a lot of people. So what I say is, if you can get into bed at a decent time, try to make it before midnight, try to make it before 11 p.m. But listen to your body. Some nights you'll be exhausted from work, and by 10 o'clock, you just can't keep your eyes open. And then there's some nights where you went for a run and now you're energized and you get into bed at 11. Great. But what you want to do is make sure you're really waking up at the same time every morning so that you can continue that sleep drive throughout the day. But getting good sleep is so vital and so important. And there's so many ways to improve your sleep that that, you know, it's so individual, but definitely, you know, limiting, you know, TV in bed. Journaling your thoughts before bedtime is a great way to alleviate stress. And I know in our, you know, in our industry, we're bringing home all those cases. Did I do that feeling right? Is that root canal? Did I, you know, are they going to be okay? How's the extraction healing? Will they get a dry socket? You know, all these things kind of come home with most of us. And it's a good way to write it out. Just let it all out, because the thoughts that we have in the middle of the night ruin our sleep. They'll wake you up. They'll make you more anxious, and you won't get that restorative rest you need to really be on top of your game the next day.
Yeah, no, definitely anxiety does not allow you to sleep. And there are nights where I wake up in the middle of the night and I don't even know why. Like, I don't know for what reason,
Yeah.
but I just do. And so I've made it a priority to get into bed. I don't necessarily sleep at the same hour, but I
Yeah.
try to like unwind at the same time so that I'm in bed, I'm decompressing, I'm either journaling or reading, and I'm minimizing the phone activity because I don't want that light, like you said. I don't want that
Yeah.
to activate the circadian rhythm. And then, so yeah, so I'm trying really hard to get into a good sleep pattern and trying to get at least 8 hours of sleep. That's my goal. 8 hours of good sleep. And recently, I've also been adding supplements to my health regimen, and it's been a game changer. Like magnesium L3
Yep.
is
I
something
was
that I've
just going
heard
to
of.
say, yeah,
Yeah,
magnesium is wonderful.
and you can't overdose on it. It doesn't make you groggy. You get a good solid sleep, and I really feel energized when I wake up in the
Mm-hmm.
morning, like a completely new person. So if
Yeah.
anyone's listening, you can try that. Um, the interesting thing is, like we've just talked about a lot of prevention, but life is also very unpredictable. And you can do the right things. You can sleep well, you can eat well, you can exercise, and you can be self-aware. But accidents happen. And
Yes.
something that you talk about is disability insurance. So how important is disability insurance? And for all these new dentists going into work, like all of this jargon it's unfamiliar. It sounds strange. Can you give us an idea of what is disability insurance and how is that protecting you?
Sure. Disability insurance is so important, and I'll be honest, I'm utilizing it right now. So, my injuries that I sustained in dentistry were impacting my patient care. So I chose to walk away for now until I can, you know, heal and get back into patient care. But I did utilize my disability insurance to do that, and it's helped me, you know, live. So disability insurance is so important. It is an insurance that helps protect your income, essentially. What it does is if you get injured, either an accident or an illness. So for example, you start to develop tremors, or you fall down the stair and break your arm and you can't work for X amount of time, months. It will help replace your income to a certain extent. Of course, they don't give you 100% matching of your income, because they want you to go back to work. They want you to try to get some sort of job or career if possible. But it helps pay your bills. It helps pay your student loans. It helps you with therapy or any surgeries you may need. Helps you cover costs for things. And that's super important, especially if you may not have financial support in other areas, whether it's a partner or a parent or any savings that can help with your bills. And so it's really vital. I've heard stories of people not having disability insurance and then they got cancer and they weren't able to work. I've heard of a young girl who recently graduated, just was in residency and was injured and is now unable to practice dentistry. She has so many loans. So it can happen at any time. It doesn't mean that if you get disability insurance, you're ever going to use it. Most dentists may not, but it's an important thing to have, because you don't know what life is, where it can take you, what can happen. It's the same, people buy life insurance for the same reason, to help protect their loved ones. Disability insurance is to help protect you and your loved ones, if you ever are injured or become ill.
Right. And a lot of people look at, as new dentists, like they look at the price tag. Oh, we have school debt, and then we have to add on this cost. People start shopping around for disability insurance. What do you think about that when you shop around for a better price? Do you think they're more or less the same provider? Like, are they providing more or less the same service, and it's okay to shop around, or should you go with the more well-known companies and secure a plan that way?
I would definitely, there's a few reputable companies that I would definitely look into. I would steer away from the ones that look too good to be true, because you want to make sure that it's a company that's not going to go out of business. I know somebody who had a malpractice insurance with a company that went out of business, literally went out of business. So, and they got sued during that. So you don't know. So you have a disability plan with a company that gave you a great rate, and then when you need it most, they don't cover you or they deny your claim. It's possible for that to happen. You can get disabled where you think you just can't practice, and they're like, no, you're fine. You could definitely practice. I've had dentists reach out to me while they're going through the process, and their doctors, their primary care providers, are saying, no, we don't think you're disabled. Now, when you go and submit a claim, your doctor has to fill out a form saying, we feel that they can't work. Now, depending on your insurance providers, they may say, okay, you know what, let's do our own tests, or let's, see how you feel with our own doctors. Some may just take the word of other providers. So you have to really see what their due diligence process is, what their definition of total disability is. Is it own occupation? Meaning, if you have own occupation, if I work as a dentist and I can no longer treat patients, I'm classified as disabled, but I can still work in another profession and be paid out my benefits. Do they have future increase options? Meaning, if you get it as a resident and you're making $60,000, and then 3 years later you're making $250,000, do you have an option to increase your benefits? And then there's also like student loan riders where you can help get student loan repayment, things like that. There's so many options, but not all companies offer the same options, and not all of them secure you in the same way, have the same reputation. So I would definitely be cautious looking at crazy good deals, but kind of steer towards the ones that are typically the more reputable companies, is how I would say it. Definitely look around. I'm all for that. You want to do what's best for you, but stay in the companies that have good reputations, I would say.
A lot of people think that this decision is like a forever decision. Like once you sign up for disability, you're stuck to that one company. Is that true, or can you move around between different companies without penalty?
You can move around. You can. The thing is as when you're younger. So if you're saying I got my disability insurance when I'm 26 years old, and at 28 I'm looking for a new company, perfectly fine. But if you got it at 26 and then at 37 you're saying, hey, I want to move and change, you may see changes in your premium, because as you get older, there's your premium increases for most people, and your health can change. Between that 1 year or 2 years, you could have started developing a neck pain, or your cholesterol changed, or your head, things had happened where it can affect your insurability, meaning will that new insurance company insure you? And then also how much change in the premium or coverage will they provide? So it's always better, the younger you are, the better it is to get with a company that you really like and that will support you long term. Most companies have like resident discounts or student discounts of some sort if you look into it. And then also there's options of premiums where there can be a graded premium, meaning when you're younger, you pay less. And then as you get older, it goes up. So that can help you if you have, a lot of loans or other bills that you need to pay. And then there's also one where you pay the same amount for your whole benefit term. But, you can get multiple plans as you get, your income rises or as you get older. So it really depends on your situation. But I wouldn't necessarily buy young and then completely change as you get older. You want to really look at your situation and say, if you're entirely healthy and you feel like, hey, I don't need my disability policy when you turn like 50, more than happy, cancel it. There's no penalties. It just really depends on your situation and really your health circumstances and how much money you need and your income at that point.
Right. No, it's definitely better to be safe than sorry. That is
Yeah.
a life lesson that
Yes.
I've taken away. But is there any other piece of advice or insight that you want to give to our listeners in the last 10 years of practice that you've come across?
Are we talking about disability and ergonomics or just in general?
It could be disability ergonomics, or it could be in general. What is like your biggest takeaway?
I think my biggest takeaway is if you're an associate, find a practice that's going to support you not only clinically, finding a mentor is fantastic, but emotionally, and who's going to help you grow. To me, that was a big thing, because I know in my 10 years of practice, I didn't necessarily look for that. And I don't think it wasn't as well talked about, like find a place that's going to support you in all aspects. It was more, just finding a job, working as associate. But a lot of people don't end up buying their own practices nowadays. And if you're working as an associate, I would say look for a place that's going to support you in all ways, because emotional and psychological stress impacts you so much as a dentist that the physical part is something you can control for a lot of it, but the environment is something else that it becomes plays such a huge role in your success, that I think that's a huge that's something I would definitely recommend for new docs out there.
I love that. You're absolutely right. You can't control the environment, but you can control yourself. That is huge.
Yeah.
That resonates a lot. So, is there anything that we haven't discussed that you'd like to add to our conversation before we sign off?
I think we've touched a lot of it, but I would definitely say that if you are unsure about whether or not your well-being is going to be affected by whether it's ergonomics, exercising, sleep, insurance, it's better to use your resources to ask. Don't be afraid to ask questions. And I think now it's definitely more supported with all these podcasts out there and all the Facebook groups. But I think as newer dentists, we're really scared to ask questions or to, dig deeper. I think that's something that we need to like kind of nip in the bud. And I think healthcare in general always is, they make it scary for you to ask questions. And I think it's so important nowadays to ask questions. Why is it like that? Why are we doing this? Or, is this the best option for me? Look at your options, ask questions, and then go from there. And I think that's really important.
I completely agree. I think it's mostly because we as dentists are supposed to have the answers as a provider. We're supposed to know what we're doing and
Yeah.
cannot show any sign of weakness, which is not knowing. So
Yeah.
asking questions is something that we shy away from. But we live in a different world where you have so many resources available. Like everyone's on social media now, and it's an opportunity not to compare ourselves to other people, but to ask questions and learn from each
Yeah.
other. And that's what I'm trying to do with my page, and you are with your page, and so I love that. So thank you for sharing all of these tidbits with us today. If someone wanted to reach out to you and connect with you, where can they find you? Like, what is your Instagram handle or any other places where they can contact you?
Sure. I'm on Instagram as Dr. Natasha Sarwar. I'm on LinkedIn and I'm on Facebook. So you can reach out on any of those platforms, and I'm more than happy to answer any questions you have.
Fantastic. Thank you, Dr. Natasha. I enjoyed speaking with you today.